On March 4th, 2016, I lost a friend of 33 years to a heroin addiction. Hello, my name is Kelly Morris, and today I'm going to inform you on addiction, how powerful it is, and how helpless it can make one feel. The three main points I'm going to focus on today are exactly how addiction is a disease, the most common addictions among Americans with statistical facts, and steps for treatment. Addiction is often labeled as a weakness or one's desire to succumb to the temptation of a substance to achieve a state of mental euphoria or physical euphoria, when in fact this is incorrect. Addiction is a chronic and complex disease that affects the functioning of our brain and body, including our central nervous system and the hormones dopamine, serotonin, and norepinephrine that are released from our brain. This can affect the functioning by blocking the synapses or the physiological process needed to produce these on our own. So this increases the need to want to do the substance again, and because our body at that point has stopped producing them on our own. Most severe form of addiction is physical. The reason that the Centers on Addiction.org references this is because you can develop other illnesses from physical addictions. Example, if you use cocaine, you could develop heart problems. If you use heroin, you could develop HIV, alcohol, cirrhosis, and prescription drugs, liver failure, memory loss. The most common substance addictions are nicotine, which include cigarettes, chewing tobacco, vape e-cigs. The next one we have is alcohol. That includes beer, hard liquor, wine, cough syrup, and mouthwash in extreme cases. You believe it or not, you can achieve a certain level of feeling drunk from those last two substances. Prescription medications, this include Vicodin, Xanax, Klonopin, Valium, oxycodone, Suboxone, methadone, Percocet, and Ativan, according to the Center on Addiction.org. These are the most widely abused prescription medications and the most highly addictive. And then you have your illegal drugs, which, marijuana, cocaine, heroin, LSD, things of that nature. The following pie chart shows you exactly the number of millions of Americans that are diagnosed with addiction at 40 million, followed next by 27 million with heart conditions, 26 million with diabetes, and 19 million with cancer. So hopefully this will put into perspective, in a visual sense, exactly how many Americans do suffer from addiction, and the fact that it is absolutely classified among the other three conditions as a disease. One in 7 Americans ages 12 and up are addicts, addicted to nicotine, alcohol, prescription medication, and illegal drugs. These have been known to cause serious damage to families, relationships, schools, workplaces, and neighborhoods. I mean, if you become a substance abuser, your only focus at certain times is how to get your next fix or how to achieve that next high. So the things I just mentioned, those fall to the wayside, and those do not become an important thing to an addict. That is a mental illness. People who abuse the drugs or alcohol, they can also experience, serious consequences, car accidents, overdoses, Sometimes they will even stoop to a level as to commit a crime so where they can get some money to get the money for their next fix. Violence in order to achieve that money, and then ultimately, if they get too far into despair, starting into the detox process, or even on the other end of the spectrum, become too high, then attempt suicide. According to the Center on Addiction.org, addiction can range in severity of levels, moderate, mild, and severe. Each range is dependent upon how many addictive traits you demonstrate, and that's how they determine where to begin the level of treatment. The treatment of an addiction of any kind needs to be overseen by healthcare professionals. It is very important and to be understood that it is dangerous to take yourself off or attempt to wean yourself off of any addictive substance. You do not know how the detoxification process will affect you, and this does need to be overseen by some kind of medical or healthcare professional, and treatment, therefore, may be required, long term even. After treatment's been received and the subject or patient has been released, the environment that they put themselves in, family, and peer support are essential for success. And when I say environment, I mean that patient does not put themselves into a situation where other addicts are present or where the substance of their choice is prevalent. This will reduce the urge to use. So hopefully today the purpose of my speech was to inform you about the disease of addiction, and that by giving you the statistics and information on addiction itself, I was able to help someone that has been affected by it, a family member that's been affected by it, and perhaps understand it a little more. My last thought is just say no. Thank you so much for your time today.